Hello, this is Bradley Graw, orthopedic surgeon at the Palo Alto Medical Foundation, and thank you for looking at this educational video on stretching for the lower extremity. This is good for injury prevention, maintenance of health, and also for the rehabilitation after knee or hip injury, as well as in the postoperative period. I am a lifelong athlete, former collegiate lacrosse player at Yale, and have been practicing orthopedic surgery for more than 10 years. The techniques here I have developed through my life as effective for these types of issues. Of note, those recovering from hip replacement should not perform these stretches until 6 weeks after surgery. This is because you will break your hip replacement precautions for dislocation if you do so. Failure to comply to this order may lead to dislocation of the hip, which is not a fun event. So thank you for waiting for 6 weeks. This is the safest way to go. The muscles that we are talking about include the major muscles of the lower extremity, including the iliopsoas, the tensor fasciae lata, the gluteus maximus, gluteus medius, hip adductors, quadriceps, hamstring, gastrocnemius, and soleus muscles of the lower leg. In order, we will begin with a stretch for the thoracolumbar spine. You need to have good flexibility and stability of the spine to support the lower leg, so important to include that here. We will then proceed to a safe stretch for the gluteal muscles, both the gluteus maximus and medius, then a stretch, my favorite, for the hip flexor, and also that for the iliotibial band. Next, a good stretch for the quadriceps, the hamstring, and lastly the gastrocnemius or the calves and the hip adductors. Be sure to stay within any joint positional precautions that Dr. Graw or his team has prescribed. This is especially important for those recovering from hip replacement. In my opinion, muscles and tendons are best stretched when the body is warm. Ideally, you should perform a cardiovascular exercise, getting the heart rate up for 10 to 20 minutes before getting the best effect out of these stretches. The program overall in regards to stretching should take about 10 to 20 minutes. Each stretch should be held generally for 10 to 20 seconds without bouncing or providing excessive tension or compression across the joints. Attempt 2 to 3 repetitions for each of the stretches if you have the time. A couple of tools that you may consider to get include a foam roller and a yoga strap. A foam roller is good for the thoracolumbar spine stretch, and a yoga strap can be used for multiple stretches shown here. We will begin with a spine flexibility stretch. This includes a good stretch of the thoracolumbar spine. Here I'm using a foam roller supporting the thoracic spine and the neck, aligning this along the center of the spine, and using this to open up the chest as well as the thoracic spine. My feet are planted on the ground, knees and hips flexed slightly. The exercise that should be done includes moving the arms in a concerted way, bringing the shoulders down the chest and then up over a course of about 3 to 5 seconds. You can then hold that position slightly. Each of these maneuvers should take in total about 10 seconds. 10 repetitions should be adequate for this stretch. The next stretch is for that of the gluteal muscles. Of note, if you are recovering from hip replacement surgery, do not perform this until you have been cleared by Dr. Graw, generally 6 weeks after surgery. What is done in this stretch is to cross one leg over the next, then grasp under the leg onto your shin. By pulling backwards on that leg, you will feel a nice stretch of the gluteal muscles. Please hold that stretch for about 10 seconds and then repeat for 3 sets. For those who have had hip replacement, this should be safe after you have gotten through the period of hip precautions. So thank you for being patient. Next, we will move to a hip flexor stretch. This is performed with one leg in front of the other, kneeling on the affected knee on the side where you will get the hip flexor stretch. With this stretch, as shown here, I'm now on my right leg, leaning forward, getting a stretch on the front of the left hip flexor. You want to move forward, holding for several seconds to feel a pull, but not significant pain in the front of that hip. The iliotibial band can get quite tight for endurance athletes as well as in the post-operative period after hip surgery. In this stretch, you will cross your legs, lean forward at the hips, and try to touch your toes. You will then reverse this, crossing the contralateral leg and then leaning forward. Hold this stretch for 10 to 20 seconds. You will feel a pull on the outside of your hips. There are many different techniques for iliotibial band stretching. The diagram shown next will show you some other options that you may like better. The foam roller can also be used to work out the kinks and break up scar tissue on the lateral aspect of the hip. The quadriceps muscle, of course, is the major extensor muscle of the knee that sits on the front of the thigh. This includes 4 different muscles that confluence together at the quadriceps tendon. In this stretch, you want to flex the knee and feel a pull in the front of the muscle of the quadriceps. You want to attempt, as shown here, to extend the hip so that the quadricep and the thigh is pointing straight to the ground. You also do not want to see any particular rotation at the hip. Hold this stretch for 10 seconds and of course repeat both sides. Next, we need to consider the hamstring stretch. The hamstring is a confluence of 3 muscles on the posterior aspect of the thigh. Keeping the leg extended and the knee extended is what achieves a stretch here. Here I'm doing a standing hamstring stretch with the heel on an elevated ledge approximately 6 to 12 inches. Grabbing the toe allows you to achieve a stretch here. You can use a yoga strap and do this on the ground. There are many different ways to do this. This one's my favorite. The diagram shown next shows how this can be done to extreme using a door ledge. It's also important to stretch the calves. The calves include the gastrocnemius and the soleus muscles about the posterior aspect of the leg. I prefer to do this in a downward dog yoga style pose, holding for approximately 10 seconds. But you can also do this in a standing position, pushing against a wall. You again want to hold for about 10 to 20 seconds, achieving a good pull about the posterior aspect of the leg. The last stretches in this series include stretches of the hip adductors. The adductors are what brings the leg and thigh towards the midline. These need to be stretched. These are often called the groin muscles. You can perform the first stretch shown here with both legs equally to one side, leaning forward, and then alternating from one side to the other. Try to hold for 10 seconds in each position. So, in review, there are 8 stretches included here for the lower extremity, starting actually with a spine flexibility exercise. Having a good, flexible, strong thoracolumbar spine is important. Consider using a foam roller for this stretch. Then proceed to stretching the gluteal muscles, the hip flexor, the iliotibial band, the quadricep, the hamstring, the calves, and the hip adductors. And again, for those recovering from hip replacement surgery, wait until Dr. Graw has cleared you from your hip precautions before advancing with this stretching routine. And remember these tips. These stretches are most effective if you are already warm. I recommend 10 to 20 minutes of cardiovascular exercise to get your muscles and tendons warm before stretching. The overall program of stretching should take just about 10 minutes, and if you make this a good habit, doing this 2 to 3 times a week, this should really improve your flexibility, allow you to get stronger, and have less pain about your lower extremity joints. Thank you very much for reviewing this video and others in this series, and don't hesitate to reach out to Dr. Graw or our team with any questions. Thank you.